Every week has a big day.
What does that mean?
Well, you think the big day is going to be the diagnosis and that's it. And then you kind of go off and if there's any treatment to be had, you have that and what have you. But actually there isn't, because then you realise that every single scan turns into being a big day, because will it show that they've found it somewhere else? Will it show that the tumour is bigger? Will it show any number of things? And then actually going to the clinic, you realise, is a big day. And if you had a little Geiger counter for the stress in those clinics, and at the Macmillan Centre, they make it as calm as possible. But still you can see, little arguments that emerge in the patient group alone, let alone the staff, of when things go a little bit wrong or somebody hasn't been seen on time or whatever. These turn into these things because they are big days. And yes, for me, taking that first dose of the gefitinib, which is this special kind of chemo that is for the tumour of mine, which is, I don't know, it's different from most of the other tumours. It's about 10% of people. I'm not sure it's 10% of people with this lung cancer or 10% of the population, who knows. But it's in a minority of people that have this particular one, that this particular drug has some evidence for shrinking a bit. So not curing, but just shrinking a bit, and it also has even bigger benefit for me of not having some of the side effects of some of the stronger chemo drugs. And that's what I want. If I'm going to live longer, it has to be with a good quality of life. And that first pill that I took that morning, I remember it so well, because it was like, well, what side effects will I get? And will it be like the other chemo? And will it be like this? And then, now, just to make sure it works, this is me, supposedly intelligent person, I think I'm going to take this pill all on its own, so none of the other pills interfere with it. And I suddenly realised what a huge event this had turned into. And now, of course, I just smile. But there is a bit of me that you do your stuff. But yeah, all sorts of big events. Like, I don't know, I've had difficulty swallowing recently, and that's new, and nobody's mentioned that. And suddenly, oh dear. And then at the weekend, I suddenly had a bleed from the tumour. And again, nobody mentioned it. So have I got time to get in a taxi to go to the hospital? I was really scared. And that became a very big day. And then it became an even bigger day, because at some time I've got to go home now. And suddenly hospitals, which I normally hate, despite having worked in them for many years, became a haven for me, and I suddenly didn't want to go home. It was like, oh my goodness me. And the doctor that I saw then, in fact both doctors, the A&E doctor and the next day when I was admitted, the oncologist there, couldn't have handled that better. It's completely up to you when you go home. You tell me when you're ready. Right. I just want a bit more information about this and that. That's it. I can go home now. How clever they are. It's very tough for them, isn't it? And I know that in my work that there's these people that so am I depressed? Can I say that I'm depressed? Or can I say I'm this, that or the other? And others who just say, I don't want a label. I mean, I'm somebody that hates labels, full stop, because I think labels do affect how we perceive ourselves, how others perceive us. They are handy as well to look at epidemiology, what's going on with most people with this condition. But both as a health professional and a person, and now as a patient, I do have a passion for making sure that we all have a chance to know that we can ask. Therefore, for me, it's not good enough to say, that person doesn't want to know. If that person hasn't told us, we don't want to know. And actually, for me, that would be, you'd need quite a lot of evidence to suggest that, because some people genuinely do not know.
Exactly.
That's not nothing to do with denial. They do not know. And for me, that has so many implications about autonomy. However, I have shifted on the other end of, when you have checked that out, don't keep going. If it's somebody that has a long life ahead of them, or even every other month or whatever, just say, and you're sure? You don't want to know anything about this? Absolutely. In an ideal world, we'd live in communities where somebody, our nearest and dearest, or our bestest friend, or whoever, would have some idea because we've talked about this. And I'm causing a lot of havoc right now in getting my nearest and dearest to all talk to each other about, what would you want? Would you want to be told? How would we be sure that you didn't want to be told? How would we be sure that you did want to be told and this is the right time to tell you? And again, it comes back to whether you're a doctor or a human being, that art of asking the right questions at the right time and then knowing when to just let it be. My father died of lung cancer in denial right until the very end. And even worse in those days, even the spouse wasn't told. So I was told, and I was told not to tell my mother, who was ill as well. And that was pretty hard, but years after his death, I had to acknowledge if that's the way he wanted to go, that's the way he wanted to go. And to a lesser extent, my brother as well. He knew he had cancer, but he didn't know he had cancer. He knew somewhere that he didn't have much of a life left, and he didn't know that, and he fought against that until the day he died as well. Well, it's certainly one of those where the humour comes in, because, yes, number 2 doctor I spoke about did a lot of paperwork that day. I mean, he just couldn't quite cope with that one. But number 3 doctor, matter of fact, did it very matter of fact when it came to the question about what happens to me if I don't have anything, chemo number 1 type or number 2 type. And that surprised me how quickly and bluntly that came. In fact, so much so that I have actually forgotten some of it. But I got the gist. But yes, I've found that since then, in my visits to the clinic, as I've wanted to know more and more about suddenly thinking, gosh, I have no idea how I get from here to dying. And that was particularly in the days when I was feeling relatively well. And I assumed it would be chest infection, but hadn't really talked about it. And people have, on the whole, shied away from answering it directly. Somehow another question comes in, and it's not until I'm out the door that I think, I didn't get an answer to that. But I think it is difficult for health professionals to face that one. It is also difficult to get away from the feeling that pain is the only thing that keeps us awake at night. And I don't know whether it is because of me, because I've lived with pain virtually since a teenager. I've had considerable pain and had to learn to live with that. That what I'm finding now is that pain is definitely not the worst thing for me. Oh, absolutely. The pain I know I will get, it will be really bad, and I will be screaming for even more of my morphine, I'm absolutely sure. But I don't have to scream anymore because everybody's made it absolutely clear I can have as much morphine as I want, that they feel comfortable with and that I feel comfortable with. It's a two-way thing. What really frightened me in this last week was, and it really has frightened me, is I know that I've always been a baby with feeling sick. Nausea just pulls me right down, so it reduces my psychological mood. It makes me feel poorly. It stops me from doing anything. I just hate nausea. And some drugs you get the nausea with, and so you take another drug to counteract that. But I faced this week how much of a vicious cycle that can be if you don't address nausea. And if healthcare professionals keep thinking it's the pain and don't ask too much about nausea. For me, I got to the stage where, okay, I wasn't eating much anyway, but I couldn't even open the fridge door to look and see what I had because I felt so sick. And it was a friend that realised it for me. He said to me, Jerry, I think you're just completely dehydrated, and that will account for some of the nausea. And that's why I have my lemon and honey and ginger and lots of it on tap, because I've suddenly realised that the decisions that I would make feeling poorly, Debbie, I would have said, okay, I give up last week. After I had the bleed and after I just got down and down with the nausea, which I didn't tell anybody about. Because I thought, well, I'm having the pill that everybody has. There probably isn't anything else. And it was the scariest thing to realise that I could have given in last week. And look at me now. I'm bright and breezy and talking to you. And that's because I've got fluid back in my body. And now I did pick up the phone to the pharmacist. And I'm on another pill, which is much, much better. But I think it is easy to assume, and for certainly the general public to assume, A, that you do get pain, because not all pain is the same, and that it will be unbearable, and it isn't, because pain care has come on so much, and you are left in charge of it. You know, how much do you think you would need? When do you think you would need it? And obviously there to protect us having too much if it's wrong for us, but always with that pain under control. But the nausea feels like the next hurdle, and different people get it in different ways. I just happen to be a baby with nausea. That is an awful lot to do. Please remember that, everybody. And that's the weird thing about having notice of one's death. Because, if we go tomorrow, then we don't have much to do because it'll have to be done for us. But if one wants to die in the best way they can for the people that come after them, it's making sure that we have our papers in order. But also that was part and parcel of me having to do so much work with my clients that one cannot just go off and die. And if one does, especially as a psychologist actually, it's just more painful for other people. And so I realised that life becomes going to the hospital and getting your papers sorted. So yes, I've got a professional executor who would make that contact with my old patients if necessary, and with my clients now in the theatre. Come the time, but there's just so much else. When did I have those premium bonds? Oh yes, no idea where they are. And just how, on a good day, that's great, because you feel as if you're doing your bit for whoever's left. But on a bad day, it's like, this shouldn't be how I'm spending my last days. So you're in that mixture all the time. It's a mix and match of these, this I can do. That bit says, but I shouldn't bloody well be doing it. You know, I just want to go and sit and be in the garden and see a few clients a week, and that's it, and be with my family. But then you realise it is for your family that you're doing it, and for your clients that you're doing it, and that's our responsibility. So I'm really pleased to have that time to do it. Sometimes it can be frustrating. I mean, the business of the blue badge, really, on a good day I can laugh at that, but I'm so lucky, Debbie, because I have so many wonderful friends and a lovely family, of course. And because I no longer drive, they all are saying, let me take you to a trip somewhere, and that's great, except for I have to get out the other end. And so a blue badge for me was just like, wow, I know they're difficult to get, but that would mean so much to the quality of my life that is left. And when I ended up realising that there's another form that a doctor has to sign to say you're about to pop your clogs or whatever, and that they're arguing about can they say 6 months or not, I suddenly got very cross with that. And I thought, there's something very wrong with these systems that put people through this, because so what? They know, if I've been told months, not years, and they're telling them that, would you honestly deny somebody that? Because the long route, it could be months they're coming through. Whereas a short route is a couple of weeks, apparently. That makes me cross, where there is no sense of how much one would like to cram into those last few months, and how life is different with something like that. And it's become my my reason for arguing right now. It is the depository for my anger. My friends will be pleased. There's anger somewhere. It is with something like that, that it's almost cruel.